Let us go and watch a movie. I hope it's not scary. You might be saying Medicare annual enrollment period is coming. That time of the season is coming. It is scary. It doesn't have to be that way. With Chronic Health Agency, the Medicare experts. It would be like walking in the park. Go to www.carnehealthagency.com or call 224-433-5754. Chronic Health Agency, we do not offer every plan available in your area. Any information we provide is limited to those plans we do offer in your area. Please contact Medicare.gov or 1-800-MEDICARE to get information on all your options. Chronic Health Agency is not connected with or endorsed by the U.S. government, Federal Medical Program, Social Security, or any other government agency. Plan for Medicare. The date that you are turning 65 is fastly approaching. Are you ready to sign up for Medicare? You can go to ssa.gov. Use the Social Security Administration SSA online services and save yourself a trip. Or you can go to your local Social Security Administration office. Plan for Medicare. Medicare is our country health insurance program for people age 65 or older. You may also qualify if you have permanent kidney failure or receive disability benefits. Let us review the parts of Medicare. There are 4 types of Medicare coverage known as parts. You can sign up for Medicare through Social Security, and you can also sign up for Part A and B or Part A only. Part A and B. Part A, hospital insurance. Part A helps pay for inpatient care at hospitals, skilled nursing facilities, hospice. It also covers some outpatient home health care. Part A is free if you worked it and paid Medicare taxes for at least 10 years. You may also be eligible because of your current or former spouse work. Part A and B continue. Part B, medical insurance. Part B helps cover services, doctors, and other healthcare providers, outpatient care, home health care, durable medical equipment, some preventive services. Most people pay a monthly premium for Part B. The exact premium depends on your income level. View what you might pay for Medicare at Medicare.gov. Sign up for Medicare. Medicare is our country's health insurance program for people age 65 or older. You'll sign up for Medicare Part A and Part B through Social Security so you can make both your retirement and Medicare choices and hold any premium from your benefit payments. If you are under age 65, you may be eligible for Medicare if you have permanent kidney failure or if you receive disability benefits. Supplemental Social Security Income SSI does not qualify for your Medicare on its own. Even if you receive SSI, you must meet one of the other requirements to qualify. Information that you would need to provide. Basic information about yourself, like your Social Security number, where you were born, city, state, and country, health insurance information, start and end dates for any current group health plans, start and end dates for any group health plans after age 65. For Part B only, valid email address and your existing Medicare number. Sign up Medicare. If you're 65 or older, you can enroll online for Parts A and B or Part A only. You can delay Part B if you're already covered through an employer group health plan. The application for retirement benefit in Medicare or Medicare only apply online. Sign up for Part B only. If you previously declined or never signed up for Part B, you can sign up for Part B only. Part B helps you pay for a basic healthcare service. If you already have Part A, you can add Part B during a specific enrollment period. It's important to sign up promptly to avoid gaps in your coverage or late enrollment penalty. Your coverage generally begins the first day of the month after you sign up. When you're ending an employer group health plan, if you have been covered by an active employer group health plan within the last 8 months, either you or your spouse, you can enroll in Part B without any penalty. This is considered a special enrollment period. Submit an application. You can apply online when you are ending an employer group health plan. During this special enrollment period, you can apply any time of the year. When you miss the enrollment periods above, You can only apply during the general enrollment period, each year between January 1st and March 31st. There are often penalties when signing up at this time. Parts C and D. Private companies run Part C and D. The federal government approves each plan cost and coverage types varied by provider. Part C, Medicare Advantage. Part C is known as Medicare Advantage. It is an alternative to Part A and B that bundles several coverage types, including Part A and B and usually D. It may also include vision, hearing, dental insurance. You must sign up for Part A or Part B before enrolling in a Medicare Advantage plan. Part C and D continue. Part D, prescription drug coverage. Part D helps cover prescription drug costs. You must sign up for Part A or Part B before enrolling in Part D. Get started with Part C and D. Review and sign up for Medicare Advantage and drug plans on Medicare.gov or with a licensed broker like Conradi Health Agency. Go to www.conradihealthagency.com or 224-433-5754. Hello everyone, thank you for coming out. Conradi will be presenting a 4-part series entitled Social Security and Medicare 101. It will be available on Facebook, LinkedIn, and also we carry on our Conradi Agency YouTube channel, the full-length version. Relax. I hope you enjoy our education video.
Welcome to Social Security and Medicare 101. Conradi Agency is not connected with or endorsed by the U.S. government, Federal Medicare Program, Social Security, or any other government agency. Agenda. What we will cover: Social Security overview, what is Social Security and who can participate, Social Security basics and benefits, consideration for collecting Social Security early, how Social Security and Medicare work together, turning 65 and working. Also, we're going to cover Medicare 101, understanding your options, Medicare Parts A through D, and what they cover, federal health insurance program and private plans, your Medicare option, meaning the original Medicare compared to Medicare Advantage, dual eligibility special need plan, we call D-SNPs, prescription drug coverage, Medicare supplement insurance, how to get started, enrollment in Medicare when eligible, and choosing additional coverage that's right for you, and frequently asked questions. We like to go over Social Security review. The main requirements of the original Social Security Act was to pay financial benefits to retirees based upon a lifetime of payroll tax contribution. It was intended to be a federal safety net for providing aids and benefits for the elderly, unemployed, victims of industrial accident, dependent mothers and children, the blind and disadvantaged American. Qualifications to receive full benefits must be a U.S. citizen or resident, pay into the Social Security system for 10 years. Social Security basics. Before you apply for retirement benefits, here are Social Security basics you need to know. Your full retirement age depends on the date of your birth. This may be between 66 plus 2 months and 67. We'll go into more details later. You can start receiving benefits as early as 62. Benefits monthly payments may be reduced if you choose to receive benefits earlier. You may choose to continue working while receiving benefits if you elect to receive benefits before full retirement age. Delayed retirement credits may be added to your benefits if you start after your full retirement. Consideration for collecting Social Security early. Working. Will you work even part-time before full retirement age, FRA? Longevity. How is your health? Is there expectation of longevity? Have you saved enough money in your retirement account, your 401k, pension, personal savings, etc.? Spouse and children. Are you married? If so, what is the age difference between the spouses? Whose benefit can the spouse and or the children collect? Do you have children under 18 or in college? Full retirement age. age to receive full Social Security benefits. If you delay your retirement benefits until after the full retirement age, you may be eligible for a delayed retirement credits that would increase your monthly benefit. Even if you decide to delay your retirement, be sure to sign up for Medicare at age 65. The earliest you can start receiving Social Security retirement benefits will remain age 62. Note, if you were born on January 1st of the year, you should refer to the previous year. If you were born on the 1st of the month, your birthday is considered part of the previous month, and your eligibility will be shifted accordingly. How Social Security and Medicare work together. Social Security Administration determines who is eligible for Social Security benefit as well as Medicare. They also carry many other administration functions for Medicare. Medicare is available to some younger Americans with disability. Social Security and Medicare are social safety programs that Americans pay into during their working years through taxes. How to determine your Medicare Part B premium based upon your income level. Typically, it's 2 years before you turn 65. They base the income on. And for example, an individual with $88,000 or less tax return or filing joint tax return $160,000 would typically pay $140.50 a month for their Part B premium. Social Security covers the original Medicare, Parts A and B. Social Security enrolls you in Part A. Medicare Part A, hospital insurance, helps pay for the inpatient care in a hospital or limited time at a skilled nursing facility following a hospital stay. Part A also pays for some of the home health care and hospice care. Note, for those who have not worked at 40 quarters or 10 years, you may purchase a Part A in 2021. You can also sign up for Part B. Medicare Part B medical insurance helps pay for services from doctors and other health care providers, outpatient care, home health care, durable medical equipment, and some preventive services. Working past 65 with Medicare benefits. Should you enroll in Medicare if you are still working? Question to ask: if your employers offer health coverage, do you need to enroll in Medicare? What about Medicare prescription drug benefit? Can I save money using Medicare instead of what my employer groups offers? Things to know. Most workers should remain enrolled in Medicare Part A, which is free for most people, covers institutional care in hospitals, skilled nursing facilities, and other caregiving agencies. Individuals who don't sign up for Medicare Part B when they first become eligible might have to pay a 10% premium penalty for each year that enrollment is delayed. About Medicare. Medicare Part A through D. Let's start at the beginning. There are 4 parts of Medicare. Part A, hospital care. Part B, medical care, called the original Medicare. Part C, Medicare Advantage, private medical plans, and typically include Part A, Part B, and often Part D. Part D, prescription drugs, Medicare prescription drug coverage plans. Medicare Part A and B, original Medicare. Part A covers hospital insurance. Part B covers medical insurance like doctor's visits. Medicare Part A and B make up original Medicare. They are provided by the federal government. Original Medicare is for people 65 and older or those under 65 with certain disabilities. Part C and D, Medicare Advantage and prescription drug plans. Part C, this is called Medicare Advantage. You can buy Part C from a private insurance company. Medicare Advantage combines Part A and Part B and sometimes offer prescription drug coverage. It can include additional benefits like dental, eye care, hearing, or wellness services. You can buy a Medicare Advantage plan, Part C, if you are enrolled in Part A and B, live in the plan service area. Part D, prescription drugs. It helps pay for prescription drugs. It's only offered through private insurance company. We'll talk more about Part D later. Chapter 2, Federal Health Insurance Program and Private Plan. Can I just rely on Parts A and B? What the government pays for? Rely on Parts A and B, but original Medicare has a deductible and only covers about 80% of your Part B services. You pay 20% of the Part B service. It covers hospital, doctor visit, along with some prescription drugs, Part B. Medicare Advantage Part C, the plan will cover Medicare Part A and B, all the same benefits as original Medicare, and may include benefits original Medicare doesn't cover, like dental, hearing, and vision care. Prescription drug care Part D with most plans. Part C also has a yearly limit on out-of-pocket costs for covered medical services, unlike original Medicare. Bottom line, Part C or Medicare Advantage combines Part A and Part B benefits, usually Part D in one plan. There are plenty of options. We can help you weigh them. Your option, how to choose your plan. Questions to consider. What monthly plan premium can I afford? Does the plan cover the service I need? Can I see the doctors I want? What about prescription drug plan? It helps to pay for prescription drugs. It only offered through private insurance company. We'll talk about Part D later, so don't stress. You can choose from two paths. One, original Medicare, Part A hospital, Part B medical, Part D a separate drug plan if you buy it, supplemental insurance if you buy it. Or second choice is Medicare Advantage. Combine Part A hospital and Part B medical. Most plans include prescription drug plan. Medicare Part D, if your plan doesn't include it, you may be able to join a separate Part D plan. If you choose Medicare Advantage, here are the two options. One, a health maintenance organization, HMO. You'll use doctors in the network. You might need a referral to see a specialist. Second choice is a preferred provider organization, a PPO. You can use doctors and hospitals outside of the network, but often for a higher share of the cost. What cost does Medicare Advantage cover? For 2021, for original Medicare, the cost would be $1,484 for a Part A deductible for hospital insurance, $185.50 per day for Part A co-insurance for a skilled nursing facility for days 21 through 100, and a $203 Part B annual deductible for medical insurance, and 20% Part B co-insurance for doctor service the plan covers. Medicare Advantage may include dental, annual hearing exams, eyewear and hearing aids, Part D prescription drugs, emergency Medicare outside the U.S., out-of-pocket medical costs, annual limit. Chapter 4, DSMP, Dual Eligible Special Need Plans. What is DSMP? DSMP stands for Dual Eligible Special Need Plans. DSMPs are specialized Medicare Advantage plans created for those who qualify for both Medicare and Medicaid. You must have a state Medicaid plan and qualify for a Medicare Advantage plan to be able to get a DSMP. How do DSMPs work? With a DSMP, Medicare is a primary payer for medical services, while Medicaid is a secondary payer. This means that Medicare is the first to pay for covered medical services. The Medicaid pays for the most remaining qualified costs. Some members will have remaining out-of-pocket costs. Why should you consider a DSMP? Much like a traditional Medicare Advantage plan, a DSMP can include extra benefits that original Medicare and Medicaid alone may not cover. This includes dental care, eye exam, transportation to the doctor appointment, and more. Now let's look at Part D, the drug plan. Here's how Part D works. You can buy this in addition to Part A or Part B. You have two choices. One, a standalone Medicare prescription drug plan called a PDP. Two, a Medicare Advantage that comes with prescription drug plan, Part 2 coverage. What you need to know about prescription drug coverage. A prescription drug plan has 4 stages. Stage 1, deductible. Until you have reached your deductible, you will pay the full discounted cost for your coverage drugs. Some plans have a 0 deductible. Stage 2, It's called initial coverage. After you have reached your deductible, you will pay only part of the cost of your covered drugs. Stage 3, the coverage gap, sometimes called the donut hole. After your plan have paid a total of $4,130, you will pay only a part of the cost for your covered drugs until you reach the $6,550. Stage 4 is called the catastrophic coverage. Once you have paid $6,550, you are out of the coverage gap and you will pay a set amount for your coverage drug for the rest of the year. Part D formulary. The formulary is a list of covered drugs based on most used Medicare prescribed drugs. A plan formulary may change at any time. You will receive a notice when necessary. For the most up-to-date formulary, visit the plan's website or call their customer service phone number. 6. Adding more to your coverage. Medicare supplement insurance, sometimes called MedSup or Medigap. Original Medicare covers about 80% of medical costs. MedSup can help cover remaining out-of-pocket expenses like deductibles, co-insurance, and co-pays. Medigap plan, sold by private insurance companies. These help cover benefit gaps such as Part A and Part B deductibles and co-insurance. They don't include Part D drug coverage. You can buy that separately. They do cover visits to any doctor who accepts Medicare patients. If you choose Medicare supplement, here are the options. 1. Medicare supplement insurance. Insurance company can sell you only a standardized plan prior to 2020 as follows. Identified in most states as plans A through D, F, G, and K through N. Second, Medicare supplement insurance companies can sell you only standardized plans starting 2020 as follows. Identified in most states as plans A, B, D, G, and K through N. If you already have or were covered by Plan C or F, or the Plan F high deductible version before January 1st, 2020, you can keep your plan. If you were eligible for Medicare before January 1st, 2020, but not yet enrolled, you may be able to buy one of these policies. Bringing it all together. Step 1. Enroll in Medicare Part A and Part B when you're first eligible. Step 2. Now you have two ways to proceed. 1. Keep original Medicare and add a Medicare supplement insurance and a Medicare Part D. 2. Buy a Medicare Advantage plan. This combines Medicare Part A, Part B,
and alternate Part D, and additional benefits.
Next questions. How do I enroll in Part A and Part B? If you are getting Social Security when you turn 65, you will automatically be enrolled. If not, you will need to sign up for Parts A and B. Contact Social Security 3 months before you turn 65. If you worked it for a railroad, contact the Railroad Retirement Board. Note, people on Social Security disability will automatically be enrolled in their 25th month of disability. When can I enroll in Part A and Part B? You can enroll in the window of 3 months before the month you turn 65, your birthday month, and 3 months after the month you turn 65. What if I don't enroll in that window? You may have to pay a penalty in the form of a higher premium. When can I enroll in Part C and D? During the same 7-month window as Part B. That means they're doing it 3 months before the month you turn 65, your birthday month, and 3 months after the month you turn 65. Times I can enroll in Part C and D. From October 15 to December 7, all people with Medicare can change their health care plans. You can switch to a Medicare Advantage or original Medicare during this annual enrollment period, join the Medicare prescription drug plan, or change plans. Are there other times I can enroll in a Part C and D? You can also enroll in a Part C and D during the special enrollment period for special circumstances such as losing your employer coverage, moving to a new service area, qualifying for extra help. What if I'm late signing up for Part D? You may face late enrollment penalty. The penalty increases based on each month that you delay. This can get costly. When can I enroll in Medigap, also called Medicare Supplemental Insurance Plan? Medigap has a 6-month open enrollment period. It can automatically start the first full month you are 65 and enrolled in Medicare Part B. For example, if you turn 65 on April 3rd, but don't join Medicare Part B until May 25th, the Medigap open enrollment period will start on June 1st. This is the first day of the month which you are both 65 and enrolled in Part B. During your 6 months open enrollment period, you can buy any Medigap policy sold in your state. What if I have health problems? During the 6 months open enrollment period, you can purchase a Medigap policy even if you have pre-existing conditions. Even if you have disability or have health problems, an insurance company cannot do any of the following: refuse to sell you any Medigap policy it offers, charge you a higher premium than they charge others who are 65 or older. What if I delay enrollment? You can apply for a Medicare policy after your open enrollment period ends. However, there is no guarantee your application will be accepted if you don't meet the medical underwriting requirement, except on a certain limited situation. For example, Medicare do have trial rights, which give you opportunity to enroll in a Medigap plan and have guarantee issue. If you are able to buy a Medigap policy, there may be additional costs due to underwriting. Know your rights. All Medicare recipients have a certain rights. If anyone violates these rights, you should file a complaint with CMS.
Thanks everyone for attending. You'll find today's presentation on Facebook and LinkedIn, and I hope to see you back for other Camaraderie Agency education videos.
For a free consultation, go to www.camaraderieagency.com or message us on Facebook.
Medigap policy. What are guaranteed issued GI rights? Current Health Agency is not connected with or endorsed by U.S. government, federal Medicare program, Social Security, or any other government agency. Your Medigap open enrollment period. Under federal law, you get 6 months at Medigap open enrollment period. It starts the first month you have Medicare Part B and you are 65 or older. During this time, you can enroll in any Medigap policy. We'll generally get a better price and more choices among policies. You can buy any Medigap policy sold in your state. An insurance company can't use medical underwriting to decide whether to accept your application. They can't deny you coverage due to pre-existing health problem, can avoid or shorten waiting period for pre-existing condition if you buy a Medigap policy to replace credible coverage. Medigap open enrollment period is a one-time period and does not repeat every year. What are guaranteed issued rights? In most cases, you have a guaranteed issued right in your other health coverage changes in some way. Like if you lose your other coverage, you may also have a trial right to try a Medicare Advantage plan Part C and still buy a Medigap policy if you change your mind. If you have a guaranteed issue right, an insurance company must sell you a Medigap policy, must cover all your pre-existing health conditions, and can't charge you more for a Medigap policy. Because of the past or present health problem, answer a few questions to find out if you can buy a Medigap policy or review all the Medigap guaranteed issue right covered in this video. Guaranteed issue right situation. This video describes the most common situation under federal law where you may be able to buy a Medigap policy, the kind of policy you can buy, and when you can or must apply for it. You may have additional rights under state law. You have guaranteed issue right if you have a Medicare Advantage plan and your plan is to leave Medicare or stop giving care in your area, or you move out of the plan service area. When your plan stops or leaving Medicare or you move, you have the right to buy a Medigap plan A, B, C, D, F, G, K, or L that's sold by an insurance company in your state. You only have this right if you switch to original Medicare rather than joining another Medicare Advantage plan. You can and must apply for a Medicare policy 60 days before the date of your Medicare Advantage plan coverage ends, no more than 63 days after your Medicare Advantage plan coverage ends. Note, Medigap coverage can't start until your Medicare Advantage plan coverage ends. You have guarantees your right if you have original Medicare and employer group health plan, including retiree or COBRA coverage or union coverage that pays after Medicare pays that plan is ending. Note, in this situation, you may have additional rights under state law. In your situation that you're losing employer group coverage or retiree or COBRA or union coverage, you have the right to buy Medigap plan A, B, C, D, F, G, K, or L that's sold by an insurance company in your state. If you have COBRA coverage, you can either buy a Medigap policy right away or wait until your COBRA coverage ends. You can and must apply for a Medigap policy no more than 63 days after the latest of these three dates: the date your current coverage ends, the date of the notice you get telling you that your coverage is ending, if you get one, the date of a claim denial if this is the only way you know that your coverage ended. You have a guarantee issue right if you have original Medicare and a Medicare Select policy and you move out of the Medicare Select policy service area. Contact the Medicare Select insurance company for more information about your option. You have the right to buy Medigap plan A, B, C, D, F, G, K, or L that's sold by an insurance company in your state or state you are moving to. You can and must apply for your Medigap policy 60 days before your Medicare Select coverage ends, no more than 60 days after your Medicare Select coverage ends. You have a guarantee issue right if the trial right you join the Medicare Advantage plan, a program for all-inclusive care for the elderly pays when you were first eligible for Medicare, and within the first year of joining, you decided you want to switch to original Medicare. You have the right to buy any Medigap policy that's sold by an insurance company in your state. You can and must apply for a Medigap policy 60 days before your coverage ends, no more than 60 days after your coverage ends. Note, your right may last for an extra 12 months under certain circumstances. Contact your state insurance department for more information. You have guarantee issue right if trial right you dropped a Medigap policy to join the Medicare Advantage plan or to switch to a Medicare Select policy for the first time. You've been in plan less than a year, you want to switch it back. You have the right to buy the Medigap policy you had before you joined the Medicare Advantage plan or Medicare Select policy if the same insurance company you had before still sells it. If that policy isn't available, you can buy a Medigap plan A, B, C, D, F, G, K, or L that's sold by an insurance company in your state. You can and must buy it for a Medigap policy 60 days before the date your coverage ends, no more than 60 days after your coverage ends. Note, your right may last for an extra 12 months under certain circumstances. Contact your state insurance department for more information. You have a guarantee issue right if your Medigap insurance company goes bankrupt and lose your coverage, or your Medigap policy coverage otherwise ends through no fault of your own. You have a Medicare Advantage plan or drop a Medicare policy because the company hasn't followed the rules or misled you. In both these situations, you have the right to buy Medigap plan A, B, C, D, F, G, K, or L that is sold by an insurance company in your state. In both cases, you can or must apply for a Medigap policy no more than 63 days after your current Medigap policy ends. What if I miss my Medigap open enrollment period? Outside of your Medigap open enrollment period, you may have to buy more for a policy. Fewer policy options may be available to you. The insurance company is allowed to deny you a policy if you don't meet their medical underwriting requirements. There are certain situations where you may be able to buy a Medigap policy outside your Medigap open enrollment period. Some states have a birthday rule that may give you GI if you enroll around your birthday. Continental Agency, we are excited to give you options. Continental Agency is appointed with over 19 carriers depending on the state you are in. We are licensed in Illinois, Minnesota, Texas, and Wisconsin. We do carry a plan that Illinois will give you GI, which means they will not ask you any medical questions. For a free consultation, call 224-433-5754 or go to www.camaraderiehealthagency.com. We invite you to like us on Facebook, connect with us on LinkedIn, and subscribe to our YouTube channel for more educational videos. What is extra help with Medicare prescription drug plan costs? Anyone who has Medicare can get Medicare prescription drug coverage. Some people with limited resources and income also may be able to get extra help with the cost, monthly premiums, annual deductible, prescription drug copayment related to Medicare prescription drug plan. The extra help is estimated to be worth about $5,100 per year. Many people qualify for these big savings and don't even know it. To find out if you qualify, Social Security would need to know the value of your saving, investment, real estate, other than your home and your income. SAA will need information about you and your spouse if you are married and living together. To help Social Security determine if you are eligible for extra help, you need to fill out an application for extra help with Medicare prescription drug plan costs, Form SSA-1020. Resources and income. What is the resource limit? To qualify for extra help, your resources must be limited to $15,510 for an individual or $30,950 for a married couple living together. Resources include the value of things you own. Some examples are real estate other than your primary residence, bank accounts including checking, savings, and certificate of deposit, stock, bond, including U.S. savings bond, mutual individual retirement account, IRAs, cash at home, or anywhere else. What does not count as a resource? SSA do not count your primary residence, your personal possessions, your vehicles, resources you couldn't easily convert to cash, such as jewelry or home furnishing, property you need for your self-support, such as rental property or land used to grow produce for home consumption, non-business property essential to your self-support, life insurance policies, burial expense, interest earned on money you can use for burial expense. Certain other money you are holding is not counted for 9 months, such as retroactive Social Security or supplemental Social Security income payment, housing assistance, tax advances and refunds related to earned income tax credit and child tax credit, compensation you receive as a crime victim, relocation assistance from a state or local government. You should contact Social Security for other resource exclusions. What is the income limit? To qualify for extra help, your annual income must be limited to $20,385 for an individual or $27,460 for a married couple living together. Even if your annual income is higher, you may still be able to get some help. Some examples where your income may be higher and you can still get extra help include if you or your spouse support other family members who live with you, having earnings from work, live in Alaska or Hawaii. What doesn't count as income? Not all cash payments count as income. For example, SSA doesn't count supplemental nutrition assistance program, food stamps, housing assistance, home energy assistance, medical treatment and drugs, disaster assistance, earned income tax credit payments, assistance from others to pay your household expenses, victim compensation payments, scholarship and education grants. You should contact Social Security for other income exclusions. Applying for extra help. How do I apply? Apply for extra help is easy. Just complete your Social Security application for extra help with Medicare prescription drug plan costs, Form SSA 1020. Use one of these methods. Apply online at www.ssa.gov/extra help. Call Social Security at 1-800-772-1213, TQI 1-800-325-0778, To apply over the phone or to request an application, apply at your local Social Security office. After you apply, Social Security will review your application and send a letter to you to let you know if you qualify for help. After you qualify, you can choose a Medicare prescription drug plan. If you do not select a plan, the Center for Medicare and Medicaid Services will do it for you. The sooner you join a plan, the sooner you begin receiving benefits. If you aren't eligible for extra help, you can still enroll in a Medicare prescription drug plan. Late enrollment penalty. Medicare prescription drug plan penalty. If you don't enroll in a Medicare drug plan when you are first eligible, you may pay a late enrollment penalty. If you join a plan later, you will have to pay this penalty for as long as you have the Medicare prescription drug plan coverage. However, you won't pay a penalty if you get extra help or other eligible prescription drug plan coverage. Why should I apply online? Online application is secure and offers several advantages. It takes you through the process step by step with a series of self-help screens. Applying for extra help. Let's talk. Together we can help you apply for extra help and find a plan that will meet your needs. Go to www.comradieagency.com 224-433-5754. You can also message us on Facebook, LinkedIn. Carney Health Agency is not endorsed by the U.S. government, federal Medicare program, Social Security, or any other government agency. Did you know? VA provides top quality health care tailored to unique needs of each veteran. Through your honorable service to our nation, you may be eligible for many health care services and benefits. Explore these and other benefits and services available through VA Healthcare. How VA benefits works. Eligibility. If you served in the active military, naval, or air service and were separated under any condition other than dishonorable, you may qualify for VA health care benefits. Current and former member of Reserve or National Guard who called it active duty other than for training only by a federal order completed full period for which they were called it or ordered to active duty may also be eligible for VA health care minimum duty requirement. Most veterans who enlisted after September 7, 1980 or entered active duty after October 16, 1981 must serve 24 continuous months or full period for which they were called it to active duty to be eligible. This minimum duty requirement may not apply to veterans who were discharged for disability incurred or aggravated in the line of duty, were discharged for hardship, or received an early out. Since there are many other exceptions to the minimum duty requirement, VA encouraged all veterans to apply to determine their enrollment eligibility. Benefits of enrolling. VA offers a variety of healthcare services from basic primary care to nursing home care for eligible veterans. Enrolled veterans are assured that service will be available regardless of where they seek their care or how often, without having to repeat the application process. VA is America's largest integrated healthcare system, serving more than 6 million veterans each year. Reason to enroll. VA healthcare meets the minimum essential coverage requirements under the Affordable Care Act. Medical care rated among the best in the U.S. No open season or waiting period for healthcare coverage. Veterans can apply for VA healthcare enrollment at any time. Reason to enroll. No enrollment fee, monthly premiums, or deductible. Many veterans have no out-of-pocket costs. Some veterans may have to pay small co-payment for healthcare or prescription drugs. More than 1,700 VA medical facilities are available. Enrolled veterans are traveling or spending time away from their preferred facility can obtain care at any VA healthcare facility across the country without having to reapply. Freedom to use other plans your VA care, including Medicare, Medicaid, Tricare, or private insurance. VA offers a comprehensive medical benefit package that is generally available to all enrolled veterans. Enrolling in VA healthcare. Quickly find out if you may be eligible for enrollment. Use the online VA Health Benefits Explorer at www.va.gov/health benefits/app/explorer to answer a few questions about yourself. You will be asked no more than 15 questions. and learn about the VA health care benefits you could receive as an enrolled veteran. Afterwards, you will be given an opportunity to apply for enrollment. If you wish, you can skip the Explorer and simply apply for enrollment using one of the following options below. The easy way to apply for enrollment is by phone. Veteran complete application for enrollment in VA healthcare by telephone. To apply, call 1-877-222-VETS 8387 Monday through Friday between 8 a.m. to 8 p.m. Eastern Time. VA staff member will collect the needed information and process the application for enrollment determination. Enrolling in VA healthcare online. Veterans can fill out an application online at www.va.gov/healthcare/apply/application/introduction and electronically submit it to VA for processing. VA will search for your supporting documentation through the electronics information system and contact you if unavailable to verify your military service. By mail, the application form can be downloaded from www.va.gov/healthcare/how to apply. Mail the completed and signed form to Health Eligibility Center, Enrollment Eligibility Division, 2957 Claremont Road, Northeast, Suite 200, Atlanta, Georgia. Zip code is 30329-1647. Enrollment priority groups. What are they and how do they work? VA administers is a medical benefit through a patient enrollment system. The enrollment system is based on priority groups, PGS, to ensure healthcare benefits are really available to all enrolled veterans. Example, priority group 1 won't pay copays for any type of care, test, or medication. The higher the priority group number is, the higher the out-of-pocket cost that the veteran pays. VA and other health plans. If you have health care coverage through other health plans, such as a private insurance plan, Medicare, Medicaid, or Tricare, you can continue using VA along with these health plans. Remember, it's always a good idea to form your VA health care provider if you are receiving care outside of the VA so your health care can be coordinated. Private health insurance. In a situation where veterans have VA health care and other health plans, community health care providers may not bill any other health plan for a non-emergent care authorized by VA. If you have both VA and another health plan and receive emergency care at a community facility for the treatment of service-connected condition, you may choose to use VA or the other health plan, but not both. There are a limitation on VA's ability to provide coverage when you have other health insurance, OHI. If you have other OHI, but the OHI does not fully cover the cost of a treatment, VA may pay certain costs for which you are personally liable unless payment by your OHI was barred because you or your provider failed to comply with the provision of your health plan contract or third-party payer. For example, failure to submit a bill or medical records within a specific time limits, or failure to exhaust appeals of denial of the payment. VA is required to build other health plans for medical care, supplies, and prescriptions provided for treatment of veterans' non-service connected conditions. All veterans applying for VA health care are required to provide information on their health plan coverage, including coverage provided under the health plan's policy of their spouses, if applicable. The VA health care benefit is not considered a health insurance plan. Enrolled veterans can provide or update their information by using the VA Form 10-10 EZR Health Benefits Update Form at www.va.gov healthcare/update health information, or calling 1-877-222-VETS or 8387 Monday through Friday between 8 a.m. to 8 p.m. Eastern Time, presenting their health insurance card to the clerk during check-in. Medicare coverage. Credible coverage. Enrollment in a VA healthcare system is considered credible coverage for Medicare Part D purposes. This means VA prescription drug coverage is at least as good as the Medicare Part D coverage. Since only veterans can enroll in a VA healthcare system, dependents and family members do not receive credible coverage under veteran enrollment. VA does not recommend veterans cancel or decline coverage in Medicare or other health care plans. solely because they are enrolled in a VA health care. VA does not normally provide care for veteran dependents and family members. In addition, veterans who elect to cancel their Medicare Part B coverage will not be able to obtain coverage until January of the following year. There is no guarantee in the future years Congress will appropriate sufficient medical care funds for VA to provide care for all the enrollment priority groups. This could leave veterans, especially those enrolled in one of the lower priority groups, with no access to VA healthcare coverage. For this reason, having a secondary source of coverage may be in the veteran's best interest. For more information, to go to www.va.gov/healthcare/about VA health benefits/VA healthcare and other insurance. Enrolling in both VA and Medicare can provide veteran flexibility. Selecting a Medicare Part A coverage comes at no added cost, whereas Part B comes with a monthly premium. Some veterans may choose to delay enrollment in Part B if they already have other, mainly employer coverage. However, if a veteran delays Part B enrollment initially but decides to enroll at a later date, then they would have to pay a penalty. In other words, VA health coverage does not protect against having to pay a penalty for Part B like it does for Part D. Having VA health does not qualify as other coverage for Part B. Veterans should bring their Medicare cards to the next VA appointment to update their private health insurance information. Medicare Part C, known as Medicare Advantage. Medicare Part C refers to Medicare Advantage plans which are offered by private companies that contract with Medicare. A Medicare Advantage plan provides all of your Part A and Part B services and usually vision, dental, hearing, and Part D pharmacy coverage. You may pay a plan premium each month in addition to your Medicare Part B premium. You must get all your healthcare service from Medicare Advantage plans, networks, or providers. This does not apply to emergency services. Medicare Part C and VA. Medicare Advantage MA plan doesn't replace your Veteran Affairs VA coverage, it complements it. With a Medicare Advantage plan, you can use healthcare providers and hospitals outside the VA system, which may be closer to home, especially in an emergency. VA out-of-pocket costs. Urgent care. Veterans may be charged a copayment for urgent care that's different from other VA medical copayments. Copay depends on the veteran's assignment priority group and the number of times the urgent care providers visit in a calendar year. Copay charges are billed separately by VA as part of the VA billing process. There is no limit to the number of times a veteran can go to the urgent care provider. VA copayment. Outpatient care is defined as the primary or specialty care that does not require an overnight stay. Copayments for outpatient care are listed in the table. Note, veterans who have a service-connected rating of 10% or higher are not required to pay a copayment for outpatient medical care. VA copayment inpatient care occurs when a patient condition requires admission to the hospital. There are two inpatient copayment rates: is a full rate and a reduced rate. Veterans living in high-cost areas may qualify for a reduced inpatient copay rate. Applying for Medicare or have VA benefits? Let's talk. Together, we can help you find a plan that will meet your needs, or to learn more how VA benefits work with Medicare. For a free consultation, go to www.camaraderiehealthagency.com or call 224-433-5754. Like us on Facebook, connect with us on LinkedIn, and subscribe to our YouTube channel. Camaraderie Health Agency is not endorsed by the U.S. government, federal Medicare program, Social Security, or any other government agency. Camaraderie Health Agency presenting Tricare for Life and Medicare. Learn how Tricare and Medicare work together. Learn how Tricare and Medicare work together. Tricare for Life is a Medicare wraparound. Coverage for Tricare beneficiaries who have Medicare Part A and Medicare Part B, regardless of age or where you live. So Tricare for Life, TFL, provides comprehensive health care coverage. You have the freedom to seek care from any Medicare participating or Medicare non-participating provider or military hospital or clinic if space is available. Medicare participating provider files your claim with Medicare After paying its portion, Medicare automatically forwards the claim to Tricare for processing, unless you have other health insurance. Tricare pays after Medicare and other health insurance for Tricare-covered healthcare services. How Tricare for Life works. Eligibility. Tricare for Life is available to Tricare beneficiaries regardless of the age or where you live. If you have Medicare Part A and Medicare Part B, you are eligible for TFL on the first day you have both Medicare Part A and Medicare Part B. Tricare eligibility requirements. When you are entitled to a premium-free Medicare Part A, Medicare Part B coverage is required to remain Tricare eligible if you are an retired service member, including retired National Guard and Reserve members drawing retirement pay, family member of a retired service member, Medal of Honor recipient or eligible family member, survivor of a deceased sponsor, eligible for a former spouse. Medicare Part B coverage is not required to remain Tricare eligible if you are an active duty service member or active duty family member, remain eligible for Tricare Prime or Tricare Prime Remote, remain eligible for Tricare Prime, Tricare Para Remote, or Tricare Select option, while the sponsor is on active duty. However, when the sponsor retires, you must have Medicare Part B to remain Tricare eligible. See Medicare Part B or medical insurance later in this video. For information about Medicare Part B special enrollment period for a active duty service member, an active duty family member. You are enrolled in the Tricare Reserve Select, the Tricare Retired Reserve, Tricare Young Adult, or the U.S. Family Health Plan. While you are not required to have Medicare Part B to remain eligible for the Tricare Reserve Select, or the Tricare Retired Reserve, or Tricare Young Adult, or U.S. Family Health Plan, you are strongly encouraged to sign up for Medicare Part B when you first eligible to avoid paying a late enrollment premium surcharge. Note, regardless of your age, an active duty family member who have Medicare Part A may enroll in Tricare Prime if they live in a prime service area or with a drive time waiver within 100 miles of an available primary care manager. TFL is managed by the Department of Defense. Medicare is managed by the Centers for Medicare and Medicaid Services, CMS. The two agencies work together to coordinate benefits. Medicare is a federal entitlement health insurance program for people age 65 or older, under age 65 with certain disabilities, and any age with end-stage renal disease, ESRD. There are two ways to get Medicare through the original Medicare, which includes Medicare Part A and Part B, or by enrolling in the Medicare Advantage Plan, also known as Medicare Part C. Tricare for Life is a Medicare wraparound coverage for Tricare beneficiaries who have both Medicare Part A and Part B. Wraparound means that Tricare will pay for the out-of-pocket costs that Medicare doesn't pay that you are responsible for, without after filing any claims. Medicare Part A, known as hospital insurance. Medicare Part A covers inpatient hospital care, hospice care, inpatient skilled nursing facility care, and some home health care. SSA determines your entitlement to Medicare Part A based upon your work history or your spouse. You are eligible for a premium-free Medicare Part A at age 65 if you or your spouse have 40 quarters or 10 years of Social Security covered employment. Medicare Part B, known as medical insurance. Medicare Part B covers provided services, outpatient care, home health care, durable medical equipment, and some preventive services. Medicare Part B has a monthly premium. Part B premium, which may change yearly and varies based on income. If you sign up after your initial enrollment period for Medicare Part B, you may have to pay a late enrollment premium surcharge, 10% for each 12-month period that you were eligible to enroll in Medicare Part B but did not. Medicare Part C, known as Medicare Advantage. Medicare Part C refers to Medicare Advantage plans which are offered by private companies that contract with Medicare. A Medicare Advantage plan provides all of your Part A and Part B services, and usually vision, dental, hearing, and Part D pharmacy coverage. You may pay a plan premium each month in addition to your Medicare Part B premium. You must get all your healthcare service from Medicare Advantage plans networks of providers. This does not apply to emergency services. You should understand, if you enroll in a Medicare Advantage plan, you will have to pay co-payments at the time of service. Tricare for Life can reimburse you for the co-payments you paid for Tricare covered services when you file a paper claim. Benefits not covered by Medicare or Tricare for Life. Examples of services that are generally not reimbursed by TFL or Medicare include acupuncture, experimental investigational services, in most cases, eye exam, routine, hearing aids. Note this list is not all-inclusive. If you are enrolled in a Medicare Advantage plan, you have to pay the co-payment for covered services at the time of service. Tricare for Life will not pay for non-covered services. How Tricare and Life works with Medicare. Medicare and TFL works together to minimize your out-of-pocket expenses. However, there are instances when some healthcare costs may not be covered by Medicare and or TFL. Healthcare services covered by Medicare and Tricare. When you see a Medicare participating or Medicare non-participating provider, you have no out-of-pocket cost for service covered by both Medicare and TFL. Most healthcare services fall in this category. After Medicare pays a portion of the claim, TFL pays the remaining amount, and you pay nothing. Tricare for Life out-of-pocket costs will cover. Tricare for Life out-of-pocket costs table. The type of service covered by Tricare, Medicare. Medicare pays the Medicare authorized amount. Tricare pays the remaining amount. You pay nothing. Covered by Medicare only. Medicare pays the Medicare authorized amount. Tricare pays nothing. You pay the Medicare deductible and cost share. Covered by Tricare only. Medicare pays nothing. Tricare pays the Tricare allowable amount. You pay the Tricare deductible and cost share. Not covered by Tricare or Medicare. Medicare pays nothing. Tricare pays nothing. You pay the bill charges, which may exceed the Medicare or Tricare allowable amount. Applying for Medicare or TFL, together we can help you find a plan that will meet your needs. Or to learn more how TFL works with Medicare, go to www.conradihealthagents.com or call us on 224-433-5754. Like us on Facebook or connect with us on LinkedIn and subscribe to our YouTube channel. We're also on Instagram and Twitter.